I guess I should start by asking you to introduce yourself.
My name is Walter Gajewski. I'm a physician who specializes in GYN oncology in Wilmington, North Carolina, at the New Hanover Regional Medical Center.
Mm-hmm.
And I've been in practice for 30 years now and getting ready to semi-retire.
I know from personal experience, obviously, having gone through this, how lucky I was that you were on my doorstep and my doctor sent me straight to you. I mean, can you kind of tell me more about how having gynecologic oncologist here helps our community, specifically having them at Zimmer, and She Rocks donates 25% of their funding to Zimmer. So just kind of want to know what your thoughts were on that.
Well, first, I think it's fortunate that we are able to be here in Wilmington, which is a relatively small community, but because we treat patients from a fairly large referral area around southeastern North Carolina, there is a need for us, and we see close to 150 to 170 new cancer cases a year in our area here. So it's fortunate that we can be here to do that, and it's fortunate that we have the facility in the medical center to do the kind of work that we need to do, and not have the patients have to travel 2.5 hours or 3 hours to a larger facility to get treatment.
So things like the infusion chairs that I have logged a lot of miles in
Yes, unfortunately.
Yes.
She Rocks and the foundation that's been developed, what's important is that helps the people here in our community.
The funding we raise for Zimmer benefits people battling all types of cancer, not just ovarian, locally.
Exactly.
Obviously, you always show up for us in a big way and for all your patients, and we really appreciate you.
Well, thank you, Kim. I really appreciate that myself, and we could continue, or hope that we can continue to have this strong foundation in our community.
Yes.
Comes down to, what I've learned way back and was taught is if you go back to what would you want done for your loved ones, and you follow that tact, then you're going to always do the right thing.
Yeah.
Just ask yourself that question: what would I do if it were a family member, and what would I want for them? And if you can do that, then you're going to make the right decision. That's the way I look at it.
It's a little hard hand.
I try to get to know everyone in a way that's more than just what their numbers are, or what their heart rate is on a certain day.
Yeah, which you do. You're amazing. You're my soulmate oncologist.